A lot of people don't consider tinnitus a big deal. They might think it's just a bit of noise in the ears and nothing they should be worried about. But the truth is, many types of tinnitus actually begin with a seemingly easy to ignore sound in our ears. How far ignored tinnitus can go? Catastrophic chronic tinnitus. How can bothersome and persistent tinnitus be reduced and eventually eliminated with a proper treatment? Many people with Category 4 tinnitus may find it challenging to envision life without the persistent noise and other associated symptoms. But in truth, this is what a proper tinnitus treatment is designed for. Please subscribe and stay tuned for our upcoming videos. And don't miss this one, as it should change your understanding of tinnitus treatments. There are three major elements used in this type of tinnitus treatments. The first is designed to provide tinnitus sufferers with the quickest and most significant reduction of symptoms. What often complicates this part of treatment is the presence of decreased sound tolerance or the coexistence of conditions such as hyperacusis, misophonia, or phonophobia. In addition, more difficulties are caused by disturbances within the auditory system, which, for example, may cause hearing loss. So, what do we do? First of all, we need to protect tinnitus sufferers from excessive exposure to sounds. This way, we can ensure that exposure to sounds will not worsen tinnitus symptoms. Now, having our patient stabilized, we have to address the high levels of the patient's anxiety and fear, connected or not connected to the tinnitus and other existing conditions. This is a highly personalized part of the treatment, and all professionals, such as registered psychologists and therapists, are using the most effective and efficient approach in choosing specific therapies and ways to make a significant difference in the way our patient feels and is affected by anxiety and stress connected or not connected to the tinnitus presence. After reducing or eliminating anxiety, fear, and stress, and helping the patient feel more comfortable with fewer problems caused by decreased sound tolerance, we now can begin the tinnitus habituation phase. This phase is designed to reduce the patient's awareness and sensitivity to tinnitus, which by itself may not be causing any emotional responses or annoyance at any level. Habituation is one of the unique abilities of our brain. It helps us to use our brain processing power to its full potential, and it prevents the overload of information which could cause severe difficulties in our ability to function properly in any environment. We can actually describe our brain as a supercomputer, surpassing the processing capabilities of commercially available computers when it comes to efficiently handling the information essential to us. So, how does our brain compare to a computer in certain aspects of its functionality? For instance, we can identify specific regions of our brain that operate similarly to a random access memory chip called RAM because they are storing and retrieving information as needed. This part of the computer allows for the usage of practically all computer software loaded onto the computer's hard drive. The capacity of RAM is crucial to the overall computer's performance. Occasionally, if there is not enough space, it cannot work effectively, making it impossible to run certain software. This issue is very familiar to people who engage in computer gaming with high-resolution graphics, but it's important for us to note that comparing the brain and computers is a simplification, as the brain is a complex biological organ and computers are man-made machines. The picture you're looking at now shows part of the human brain, which is designed to make us either aware of specific sensations or disregard them as insignificant without the need for conscious attention. This is one of many safety features in our brain that allow us to function. Due to the limited capacity of our human version of the random access memory chip, we are consciously aware of what truly matters to us in any given moment of our lives. This makes the habituation process a very important brain function because it allows us not to be aware of stimuli constantly present in our environment. This is why some people who have experienced tinnitus, even at a very intense level, can with time get used to the presence of tinnitus noise to the point that awareness of tinnitus is almost gone. As you know now after watching our videos, habituation is also included in the tinnitus treatment we are providing our patients within our clinic. Habituation and brain conditioning actually make tinnitus go away. The difference is that with habituation and brain conditioning, chances for tinnitus to return are minimal. Unfortunately, natural habituation doesn't work the same way, and in many cases, with some triggers present, tinnitus can come back at sometimes even catastrophic levels. In one of our future videos, we plan to discuss tinnitus setback prevention and we will talk about habituation again. In the meantime, please subscribe our channel to make sure you are going to be notified when our next video will be posted.